Welcome to I-CBT Fridays, where our mission is to educate and disseminate information about inference-based cognitive behavioral therapy for OCD. We meet every Friday from 1 to 2 p.m. Eastern. We open the meeting at 12:30 for informal consultation and collaboration and getting to know each other. So you're welcome to join at 12:30 or on 1 on Fridays. Every Friday, we either have a presentation or a case consultation meeting. And in January, we're going to be starting a book club where we're going to go through the clinician's manual, one chapter each week. So we hope you will join us for that. I am Margaret McCall, and I, along with Sylvie Levene and Mary Hosbrough, are the facilitators for this group. Today, Lucy Grantz will be presenting on existential OCD. The meeting is being recorded, so please, when you ask questions, if they're client specific, keep them pretty generic without compromising your client's confidentiality, as it will be recorded and posted on the I-CBT website. Now, I'm going to introduce Lucy Grantz, who will tell you some information about herself and get started on her presentation. She will be pausing at times for questions, so you can wait, just raise your hand in the chat or put the question in the chat and one of us can ask the question for you if you like. All right, Lucy.
Thank you, Margaret. Thanks for coming, everyone. I'm a therapist in Minneapolis, Minnesota, and I've been treating OCD for about 5 years. I also have lived experience. I started having OCD symptoms when I was 17 and didn't realize that it was OCD till my mid-40s. So I had it a long time. Because of that, I've become passionate about education on OCD. So I'm breaking this down a little bit into sections, just to let everybody know what to expect. So first, I'm going to be defining existential OCD. So we have a kind of a shared idea of it. And then, let's see if I have to move this here. So when I asked in the Facebook group what people were interested in knowing about OCD, a few people posted about how do we differentiate kind of a normal existential transition or crisis versus OCD. So I'll be talking a fair amount about that and how I do that. And then I'll be going into more how do we apply this to the modules? How do we use I-CBT how I like to use it? And then I have a little bit also about working with active rumination, because that can be kind of tricky to work with. All right. And also, just so you know, I'll be pausing at the end of a section, and then we'll take questions at those times. Okay, so I chose existential OCD for this presentation because this was a presentation of OCD that I had at various points of my life. I think it's a really interesting type of OCD, and I was doing this I like to have people sit for my presentations before I give them. And so I made my husband sit for this presentation last night. And I was trying to think of a good metaphor for it. And I was talking about how it's sort of like a puzzle when you're working with existential OCD. Well, with any OCD, right? Trying to figure out, is it OCD or is it something else? And he said, and I said, it's kind of an interesting amorphous puzzle. And he said, it's kind of like a puzzle made of Jello. And I thought, okay, let's go with that. That's a good one. But as we know, it can be hard to disentangle what's OCD from a true existential moment or crisis. And a lot of our clients with this presentation prize deep thinking. And that's a true value. But it ends up getting kind of lost in the morass when it gets in the OCD realm. So, but I also, again, as I was saying, I had this presentation myself, and a little bit about my story. When I was 15, my father died. There's a young picture of him in the 70s. and it was a sudden loss. And then the year after that, when I was 16, my first boyfriend got a brain tumor. And so because of these really challenging early experiences, it caused me to have what I would say are both OCD. It was a big OCD trigger for me. I'd never had it before until I was 17, but also understandable. We were just talking about religion before, understandable kind of reasonable doubt about the existence of God and what the meaning of life is and that sort of thing. So I know from firsthand experience both of these kinds of OCD and then reasonable doubt. And I think that really helps me with my clients because I can kind of get a sense of it, felt sense. So first, I'll be defining existential OCD a little bit here. So I love to Google things, just as we all do, I'm sure. But I thought I'm just gonna Google existential OCD and see what comes up. And there was actually a pretty good article on Very Well Health. So I was kind of surprised because I think of it as being a little, not well known. But what this article said was intensive, or some of this was from the article, and then some is just general knowledge. But so intensive focus on the meaning or purpose in life, and then questions about if I exist or if I'm in another reality, those kind of more metaphysical questions. And then intensive concerns about death and dying. And so those are pretty different if you think about it. Like the focus on meaning or purpose in life is pretty different from do I exist? So I think it's helpful to see that when questions come up so we can define it. When I do presentations on OCD, one of the things I like to do is, especially for clinicians who may not have OCD, I like to try to help people understand the internal experience of OCD as much as possible. So what, or like common or internal experiences with existential can be that derealization or depersonalization. So that's, as I wrote here, surreal, kind of floaty and ungrounded, sort of like there but not there. I remember in social situations when I had this come up, it was kind of like I'd be talking to somebody and I would feel like I was there, but somehow weirdly disconnected, almost like through a screen. And then also there can be that sense of impending doom or dread. Especially, I talk to clients a lot about how do you wake up in the morning? Are you, experiencing this right away? And a lot of people are. Certainly isolation, when we're caught in our thoughts, it's hard to really feel connected with others. So even, again, if you're around people, it might just feel like you're isolated. And then as with all OCD, there's that urgency, like I have to find the answer to these big life questions right now, even though nobody ever can. And then a lot of indecision. And then I also like to talk about brain fog a little bit. This comes up in some of the Facebook chats as well. That, when you have brain fog, and so some people might get this with like migraines or COVID or allergies, get that sense of like brain fog or you're tired. Those kinds of things can be triggers to exist, like do I exist, getting that sort of floaty feeling. And then what can happen with that is that then somebody might go into testing. Am I still feeling this? Do I exist? And then that can perpetuate those kinds of feelings. Okay, so anybody who did their extra credit, the A+ students, This is a scene from the movie 8½, which is a Fellini film from the early 60s. And so the movies I suggested are not about OCD, but they're about more kind of like, I guess, normative existential moment in the characters' lives. And this was actually, I'm including this though in the experience of OCD because it's a dream sequence and it has that real kind of surreal quality. And I think when I watched it, I had that sense of like floating, because he is floating, and you get that sense when you watch the dream sequence. So if you haven't seen the movie, I do recommend at least watching the first 3 minutes, which are easily accessible on YouTube. But anyway, here the main character Guido is floating off the ground, kind of like a balloon, and then he's holding himself. And then here the character is just falling into the water. And so I remember, I don't remember if this was at my BTTI or in general kind of research on OCD, but I know they talk about how for somebody with OCD, the experience of having it can feel like a train is coming at you, but nobody can see it but you. But like that's the intensity of fear that's inside. And when I talk about like my own inner experience, it was really like that idea of like falling off a cliff, and you don't know if your parachute's going to open, but it feels that intense. Okay, so we can pause and take any questions here. Questions or comments?
There aren't any questions in the chat, but feel free to just jump in and ask a question if you have one.
So, how would you distinguish that morning dread from between OCD, existential OCD, and depression?
Well, hopefully that will get answered here, but let me know at the end of this section if it doesn't.
Okay, thank you.
Yeah, thank you. Okay, so yeah, how do we identify existential OCD? Part of it, I think we can really look at our own internal experience as therapists when we have some clients. You know, what does it feel like to you? So I know for me, if I have a client who's ruminating a lot or gets lost in tangents, I can feel you know, a little disconnected from them, and also ineffective. So you might get to the end of the session and feel like we never really got traction here. And so in those cases, I think we're going to be often looking at clients being in session ruminating. So that's one way to tell. And then, so going more into these films, I was grappling a little bit with this, like, how do we differentiate like a true existential kind of moment from OCD? And so I had the idea to talk about movies because that can give more of a concrete sort of feeling. So hopefully this will help. But going back to this Fellini movie, 8½, it's about this man in midlife who is feeling really disconnected from both his, it seems like his career, but also from others. And he's trying to reconnect with people through having affairs. And it's not, a very functional way to try to reconnect, but that's what he's doing. But I think the thing that makes this, in my mind, not OCD is that he is going through life connecting and trying to connect with people. He's interacting with people, but he's not ruminating like a lot of clients would do, just kind of lie in the bed, ruminate, try to figure it out. And I remember that experience of wanting to wait until something's over so I could just go think about it. So you don't see him doing that. I also think this is really a stretch, but I'm going to go with it. In the movie, he has a couple fantasies that are so one of them is he shoots himself because he's I don't know, fed up with life in the fantasy. And in the other fantasy, somebody who is annoying him gets hung, and he doesn't have any distress about it, or doesn't appear to. And so it's sort of like how we talk about some people having intrusive thoughts, but they are able to go on. So again, this is a stretch, but if we were trying to like just diagnose somebody, I would look at that and say, well, that doesn't seem OCD-ish to me. But anyway, so some of the other movies, Lost in Translation, in this movie, it's similar in that the two main characters, Charlotte and Bob, are going through life. In both of their cases, they're feeling disconnected from their spouse, but also it seems their purpose in life. And so they are moving through life trying to find reconnection, which they do seem to find in each other. But I think, again, in this situation, like the character of Charlotte appears to be having, they both seem to be having some kind of more depressive symptoms. Like, they appear to be depressed. It seems like that's how it's being depicted. But again, they're still, moving through life, trying to reconnect, versus being in here trying to reconnect, which is what we do with OCD. And then the last movie was Father of the Bride Part 2. And in this one, this is more of a like kind of a stereotypical look at midlife, where the Steve Martin character, he like dyes his hair, and I think he got a new car or something like that, a fancy car, in response to difficult life changes that he was struggling with. Again, though he is not getting caught up in here, he's in his life. So actually, you know what? I think maybe I'll hold on questions till we go through this one, because I think that'll, okay, let's pause. Are there any questions? I am going to talk more about now how to identify OCD versus existential, but anything else? Nothing from the chat?
There's a question, Amanda, and you can ask it yourself if you want, but I'm happy to read it and you can elaborate if you need to. It says, seems like the extroverted route versus the introverted route, maybe. Would it be possible that the person who isn't obviously ruminating maybe just isn't aware of their thoughts? I really don't know, just pondering. I'm not sure what the question is, Amanda.
Okay, I'm not trying to make this difficult, so if you want to not answer this now, totally fine. I might be thinking about this too much, so you can be like later, and that's totally cool. But I'm wondering if it's possible that I didn't watch the movie, but if the person could be acting like the person in the movie, but just not be aware of their own thoughts, right? Because sometimes people don't pay attention to what they're thinking, so they might seem like a carefree spirit, but then you might see by what they're doing, the symptoms of like their actions, that like there's something going on in their head, and that you can tell, but you can see what maybe is going on in their head, but maybe they don't even know what's going on in their head. Do you know what I mean? So like they might not come in obviously ruminating, and they might not be aware, might not be like tuned into that. Do you see what I'm saying?
I think so. I'm trying to think. So do you think people with OCD are not aware of that they're ruminating, or that they're thinking a lot?
I've seen clients that come in with compulsions that aren't aware of their thoughts until we start talking about it.
Oh, I see what you mean. That's an interesting question, because I'm thinking that I mean, in my experience, that you talk to them about it, and then they are able to see, yeah, like you're saying, that they're ruminating, so they have some awareness. It's just not super conscious.
What if they think they're like exploring ideas, like they're just figuring things out, but they realize how problematic it is? Is that what you're saying, Amanda?
Yeah, like they can be thinking about something in a way and they don't see it as being a problem.
Oh yeah, okay. Kind of like that. And I will be talking a little bit more about like that value in being philosophical, for instance. Is that what you're getting at? Yeah, and so then a lot of the work is, how do we tease that apart from
we're supposed to freeze it within 5 days of receipt, and this happened on Wednesday.
Being helpful or OCD. And so I will be talking a little bit more about that. So, but let me know if it doesn't get addressed. Okay, so now going into, is this OCD or true existential crisis? So we can look and see and check in with a client. Is there any checking, testing, or tallying going on? Or like, are they counting how many years they've been alive, that sort of thing, or checking their feelings or checking their thoughts. And when they are thinking, is there an increase in distress just with what they're thinking? Like, because we know when we go further in the bubble, it can just get more and more distressing. So that is one way to differentiate between like a philosophical, a true just kind of philosophical kind of exploration versus something that's more OCD and more distressing. And do these thoughts seem internally generated or external to the world? Like in the movies, they're again, they're interacting with the world, whereas oftentimes in OCD, it's interacting with the thoughts. And again, with all OCD, is there a sense of urgency? Like, do I wake up in the morning and feel like I have to figure out the meaning of life, when what I really need to do is get my breakfast or take a shower? And is it, are these repetitive and unanswerable, unsolvable? Of course, a lot of philosophical questions are, right? But they don't all cause that level of distress. So then we want to look at, well, are they causing you distress? And then that would be more likely to be OCD. So I'll sometimes ask, does this feel productive, or does this feel interesting to you, or does it just feel distressing? So that can be a way for, and then I like to ask those questions for clients too, because then they can start to be thinking about it for themselves. And then they can have that to use outside of session. I also think the idea of, I've heard Fred say about deductive reasoning, that people with OCD are, I think, more adept at than others at deductive reasoning. And so are people coming up with something like, my life is meaningless. If you have that as your kind of answer, then of course we can think of all kinds of reasons why that's true. We can make a case for that. So that's looking at kind of the thought process and the meaning-making process for people. And I alluded to this before, but are these questions out of context to what's needed for the moment? So again, it's like, if I need to go write my resume, am I just going and putting some words on the paper, even if I'm not sure what to write? Or am I getting caught up in if I'm, doing what I want to do with my life? Like those kinds of questions are helpful at some points in life. But if what you need to do is just write your resume, that's out of context and not helpful. So the Mighty has all these great quotes from people with OCD. It can look like still waters on the outside while a hurricane is swirling in your mind. I think that's a really powerful quote. And another thing you can look for clients, with clients in session, and I mean, I've recently had a new client do this where I asked a question and they just kind of stared off into space a little bit. And so what's happening there, and this again is one of those intangible things, but you can kind of get a sense when people are there but not there, you know. And I heard this called the OCD stare. And so you can look for that in your clients too, where they might seem to be like, you can feel a little bit of a disconnection. And then as with Carl's presentation on, I think it was imaginal absorption, you can draw them back in relationship in session. And that can be a way to help clients get the feel of like, what's it like to be connected versus in my thoughts. Okay, let's pause again. Any questions? And if any question is really complex, what we can do too is have more of a discussion at the end. That is, if I can't answer something. So, but anything so far?
Lucy, I know one thing that I've done is say to clients, hey, if you're taking a philosophy class, you think about the philosophy class when it's time to write the essays. You're not in a philosophy class right now.
Yeah, exactly.
And that can be helpful.
Exactly. And the philosophy class should be interesting, right? Instead of distressing, unless you're
absolutely
taking ideally.
Quick question. I was wondering if you, like, what the percentage is of people that have existential OCD and then some kind of other theme, right? So maybe they have number counting or just right OCD, or, you know, yeah, I'm just wondering if for those of us who maybe we notice the other theme first, right? And then that can kind of clue us into maybe that these existential questions are more than just questions that, okay, maybe I need to dig a little more. So wondering about your experience with that.
Oh yeah, good question. I have no idea, but it's a good question. And I'm sure it's really high. And, you know, to some extent, I know this question has come up, and I think it's a good question, which is, it's all OCD, right? So it in a way, it doesn't matter what the presentation is, because we're really looking at, is there kind of a maladaptive way to try to get reason, you know, and creation of doubt. But I do think looking at these, personally, as somebody with OCD, I think it's helpful to look at categories, because I don't know if I would even have identified that I have OCD without knowing about the categories. But anyway, that's getting off track a little bit. But I think it's, you know, I mean, I can't think of a single client who only has existential, but of course that could bleed also into like religious, you know, and other kinds of, like, I think a lot of people with existential could have a tendency to have like a relationship OCD, or religious, or other kind of mental pure O types of OCD.
Lucy, I was just thinking about even the question that Deborah posted about bleeding into other areas, and the question of the prior that Christine wrote up. It's almost like if you look for the vulnerable self theme, you will find something on the lines of like, I'm a person who doesn't really know who she is or he, and then that could inform many different components of OCD. Am I correct that way of thinking?
Oh yeah, or like incompetent, or like I can't make a decision, those kinds of things. Oh yeah, totally.
I don't know my true self, and that could inform things like sexual orientation or things of that nature.
Yep, exactly. Anything else? All right. So now we're getting into I-CBT and existential OCD. All right. So the I-CBT objective is to restore a client back to their real self so they can be grounded in reality and no longer at the mercy of their reasoning errors. So my pandemic sanity saving hobby was and still is sewing. And so I love a good sewing metaphor. Again, when I was telling my husband about this, I referred to the bobbin, and he's like, you'll have to explain what a bobbin is, because not everybody's going to know. And I thought, doesn't everybody know what a bobbin is? Anyway, so the bobbin is the thing that goes under the foot, and it's got thread in it. And then the bobbin and the spool, which is up here, help you sew your garment. They work together. But I think that OCD, I love this metaphor, like when we're in our OCD thinking, it's like a tangled bobbin, and it's like things are not running properly, working smoothly. And there are a few different reasons why a bobbin can get tangled. And one of them is if it's dusty in the bobbin case. Also, if the needle is, bent or like a little bit broken, or if you have a really thin fabric, it gets caught underneath. And so especially with existential, boy, things can get really entangled. So I felt like this was a good metaphor. So what we're doing with I-CBT is helping to kind of get this machine running smoothly so that they can get traction in their lives and then, create beautiful things, which is really, operating from the real self. When we're in the real self, we can be creative and respond to the world flexibly and spontaneously. Does everybody know the movie Inside Out? I'm kind of assuming most people do, especially therapists, but my husband couldn't remember it, so I'm not going to describe it, because I think as therapists we must all know. But anyway, I like this quote too. Ever seen Inside Out? With OCD, it's like doubt has its own control console. So you can see in some of these quotes that people also use this machine kind of metaphor. Like I hesitate a little to use a machine metaphor because as humans we're not machines. But I was a kind of more psychodynamic and systems therapist prior to becoming an OCD therapist. And now as an OCD therapist, I do feel almost more like a technician in a way. Because again, once we get this machine running properly, then people can have their lives back, and it's very powerful. Okay, so some common obsessional doubts. Now I'm getting more into the modules. So some common obsessional doubts. I do have some that clients gave me permission to use here. So what if I don't exist? What if I have no purpose? What if there's no future for me, or I'm running out of time? What is the meaning of life? And what if I can't figure out the meaning of life and I can't tolerate those feelings? And then for one client, what if I'm inappropriate to life? And just to highlight the total creativity of OCD, which sometimes I have to respect it. Maybe I'm not a bad person here, but I might be in a different dimension. So it's a great example of how OCD gets you coming and going. It's very clever. And you can see how that's not something that you can really challenge. You just have to step out of it and look at the construction of the OCD. Because the more you try to reason somebody out of that, the more stuck and intertwined it's going to get. Okay, and so some common vulnerable self themes, which can be the same as the obsessional doubts. I'm inappropriate to life. I'm doing life wrong. I'm failing at life. I have no purpose. Or, there can be more general, like around negligence, which can cause people to get looped back into ruminating because it can feel negligent not to ruminate. And so, like Sylvie was saying, you can see how these kinds of vulnerable self themes could really apply in other areas as well, or to other presentations. All right. So some possible reasoning errors behind the doubt could be, I hear about people dying unhappy. So I have to figure this out because I can't possibly, stand the idea of dying unhappy. Or maybe something like my father never liked his job, and what if that becomes me? Or I know a lot of people who make career changes, so this must be important to attend to. This is a total, like I made this up, but the girls in middle school were shallow and I pride myself on depth. So I got to keep figuring this out. All right. And, so a potential OCD story, I'll read this. I wake up in the morning faced with the day, and right away I have the feared thought that I have no purpose. I feel an intense sense of dread and I get stomach aches. I remember hearing stories about people entering old age with regrets and how they lived their lives, and I'm terrified that I'll feel that way too. I don't think I can tolerate the possibility of living a meaningless existence and constantly feel like I have to figure out how to avoid that. I'm kind of assuming here that people know the modules at least somewhat, and so we can but talk about it more after if anybody has more specific questions about those. So with this OCD story, again, we're getting at why it feels so real and why it feels compulsory to do compulsion. And so we've got some reasoning for the doubt in there. You can see, I hear about stories about people entering old age with regrets about how they lived their lives, and I'm terrified that I'll think that way too. And you can imagine, like, there are plenty of stories about that out there. And then, so I do, for the most part, when I'm doing the modules, I do them in sequence. I know some people mix them up. I do generally do them in sequence, but I'll introduce them early a little bit, like just to give people a flavor for what's ahead, or if it really seems like one applies. So I'm showing the alternative story here next to the, my dog, next to the obsessional story, because I wonder if can everybody hear my dog barking out there? Okay, he's barking and it's really throwing me off. But just to show them side by side. And so when I'm doing an alternative story, I like to make it really basic and concrete, related to existential OCD, because that type of presentation can get so muddled so quickly. So I want to like make it really simple. So I know that I have adequate intelligence to manage my needs in life. I've had periods of time where I fed myself regularly. I can drive a car, I can interact with others, and I have a steady group of friends. These are examples of how I am able to manage life. I even notice a sense of lightness when I engage in these activities. I'm learning more about what I authentically want in life, and this guides me to take proper action. So in this alternative story, I'm trying to get, again, really basic, but also at the end, I'm adding that, I don't have all the answers now. I'm working on it and I'm learning, but this alludes to the idea that life does unfold along the way. And when I do an alternative story or like looking at the real self, again, as somebody with lived experience, I remember what the bubble feels like. It feels really bad, but it feels also very dramatic. And when we're looking at the more things that are more in line with the real self, it's not super dramatic unless there's something dramatic happening in life. But it's pretty mundane. You're just going through life and, you know, getting your breakfast. There's no just right feeling when you get your breakfast. You're just getting your breakfast. So I do like to address that with clients. So when we're writing the alternative story, I'll check in with them a lot, like, well, not a lot, but how does this feel? Does this feel just true? And that's what people will say often, like, oh yeah, it just feels true. And so I'll do that education about the felt sense of, you know, how we want life to feel, because that'll help guide them back to their real self. And so questions to help increase, again, more the ability of identifying, you know, especially with existential, is this the, you know, real self versus bubble? So it can be helpful to know these exception questions, like when is the OCD not there? When are you enjoying your life? So for some people, it can be things like cooking or exercising that really take your attention and focus, and things you enjoy, or things that just feel like contentment instead of this high drama. And, you know, that's normal. That's what we want in life. But, you know, one of the things I've started to do when I'm trying to help people get at this is what I used to work more with children, and or, you know, maybe dogs are a better example, but when we're trying to you know, change a behavior or help parents change behaviors, we talk about when a child is doing what you want them to do, it's easy to miss because there aren't a lot of, it's not dramatic. But when the dog or the child are misbehaving, you know, that tends to take our attention. So in the same way, OCD, the bubble, really takes our attention. What we want to do is catch it when we're in the real self, because that just helps us get a grounded sense of what that's like, that felt experience. Another way I'll help try to guide people back to their real self is, like, if they're asking me something, could be sometimes a reassurance kind of question. I'll say, well, what does your real self think about that? Oftentimes people can step out of the moment and speak from their real self. And they'll say, like, well, my real self says da 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 da. But then, you know, so you can see where they start to get where they want to cross over. Cross over into the bubble, that is, in case that wasn't clear. So reality sensing can be tricky because it can just loop back into compulsion pretty easily. And for me, before I knew I had OCD, I realized that I didn't realize that meditation was becoming compulsive. And even when trying to do a real grounding kind of meditation, it would, you know, a reality kind of, or like look at the flame, you know, that kind of meditation, it can pretty quickly get, it can pretty quickly go into compulsion. So instead of doing much with reality sensing, that is, if it maybe it works for some people, but if it's not working, then we can focus on the construction of the story, and you know, focusing on what the reasoning error is, where it's occurring, identifying, you know, helping clients. I love this idea that's been talked about slowing down. This is really helpful because with some of these mental presentations, it goes so quickly into the bubble. So we have to slow down a little, take some moments, you know, breathe, or whatever is needed, and just notice what's happening. And so that can be really useful, so clients can start to see the crossover point. Also looking at the construction of the story. Like I've talked about before, the difference between the bubble and the real self. Discussing imaginal absorption, helping them understand like the Carl's metaphor of the movie, how absorbed we can get in that movie, versus real life, which is, again, not a lot of fireworks usually. And then just focusing again on really mundane kinds of things. Okay. So, you know, one thing I'll just say too, I think I've talked about this already, but when somebody has existential, it really can get into the details of life so much, and it can really create a lot of indecision, and then it just can get this layering kind of effect. So we want to simplify as much as possible. And then looking at the selectivity of the doubt is always helpful, like to help clients understand what that feels like to construct that story that's specific to their vulnerable self theme. Whereas like for me, I never had an issue with germs. So it's hard for me to imagine having a lot of distress about that. But you know, it sure feels real when you have that theme. So for clients to see that, or where they don't have OCD in a certain area anymore, can also be really helpful for them just to see that mechanism in action. So I think testing is always a good one to help clients see, probably with any kind of OCD, but I think this happens a lot, and it happens really under the surface with existential. Just really getting into like, how do I feel about this? How do I think about this? Also, you know, again, with some of these mundane tasks like getting breakfast, taking a shower, people can be searching for like, am I doing enough? Do I feel that certain feeling that makes me feel like I'm doing enough? And again, it's not going to be there because you're just showering. So helping them see that there's not a big feeling when you're showering, you're just showering. So don't let OCD fool you into thinking that it seems like it should have more fireworks with it. Yeah, and then psychoeducation on tricks and cheats, like going deep, is a good one with existential OCD. Now I want to talk a little bit about working with rumination, because a lot of people with existential OCD can be big ruminators, and they can bring it into the therapy session. And I will say, even as a big ruminator myself, I think it can be a little challenging to work with for a few different reasons. So it's like a broken machine. Thoughts go in your head, get stuck, and keep going around and around. So working with rumination, you know, one of the things I really struggle with clients is that it can feel rude to interrupt rumination, but it's also good to remember that rumination is just as much a compulsion as if somebody came in washing their hands with alcohol. It's really no different. It's just not as obvious. And it can be enormously powerful to help clients see this in session. So sometimes I'll educate clients ahead of time about, you know, that this happens, and that I'll try to stop them if they're ruminating, or if I can't tell, just so that we have that shared awareness of that, because I'm uncomfortable with it sometimes. But if I do stop people, I'll say, does this feel like rumination to you, so that they can start to get a feel for it themselves. And then I'll say, like, is this reasonable? And I'm not always sure if it's rumination or not. But more importantly, I want them to be able to know. So again, does this feel interesting, like an interesting philosophy class, or does it feel oppressive? And I like to say also with compassion work, I remember therapists telling me, that I was hard on myself, or I needed to be more compassionate. And it always felt like then I would get really hard on myself, even more hard on myself, because it was like, why can't I just be kind to myself? So I think the most compassionate thing we can do is help people interrupt this process, so they're not just constantly berating themselves over and over internally. Another thing I've noticed, so I've been around for a while at this point in my life. And like when I had my early traumatic experiences, we didn't even have therapy. So it's really interesting to see how a lot of people, and young people especially, are really well educated about trauma and different therapy modalities. And sometimes I think that can come into the rumination process, I've noticed. And so that can be another complicating thing to identify, okay, is this trauma or is it OCD? So just be aware of that as well. And, move forward gently. Yeah, so if you do, and I mean, this is going to happen, if you feel like you've gotten into a place where you're, I've heard Michael Greenberg call it co-ruminating. If you feel like you're co-ruminating with your client, just pull back and try to, look at the bigger picture and see where you cross the bridge. Other things to educate about, I talked about going deep, but you can talk also about living the fear, and let's discuss it. Because that's where we get this kind of idea of blending being philosophical with ruminating. Okay. I just want to say also some words of encouragement for anybody who's starting off with I-CBT. There's so much to it. And I think I have a picture here of a shed. It's not the shed that my husband and I are building, but it's a shed. And I was thinking about this shed that we're building. And think of I-CBT as being like building a structure, and you have to get like the big pieces on for it to be sturdy, and then later add more details. So I really I still forget a lot of the tricks and cheats. I don't have them all memorized, and I forget about things like blending, but I think we can do so much with just the big structure of I-CBT. So I just encourage people to not get too lost in that. And then a couple more thoughts here. Okay, so grief has been touched on, and most of the people I know who go through OCD therapy, it's really crazy once you realize what a huge role compulsions have had in your life. And so when you do work on this rumination stopping, just know that there will be grief. And at this point, I put gears here because it's like you can start to feel the traction of people being in like a true therapy process versus the OCD. So just be aware of that, because it's not rumination at that point. Okay, finally, I just want to say a big thank you for everybody. I love being in this learning space. It means a lot as somebody with a history of OCD, thankfully being on the other side of it, just to know that how much effort we're all putting into this, trying to learn this amazing modality, and our commitment to our clients. And then my dog. Okay, I thought there was going to be more time, so I'm sorry there's not more time, but that's it. So if there are any last minute questions or comments.
You want to stop sharing your screen so we can all see each other, and then
Oh yeah.
And we have 5 minutes. So thank you so much. That was excellent. I'm sure everyone got a lot out of it. So if you've got some burning questions, you have now 4 minutes to ask them.
I'd thrown this in the chat, Lucy. First of all, awesome job. This was incredibly helpful and useful. So thank you so much for doing this. With the reality sensing, I understand that the focus is on the real self and a little bit of the internal sense data. So there's no, I just want to confirm. So we're not using the 5 senses in any way, right?
You know, I don't. I mean, I think you can try, you know, doing some grounding and see, because I think doing some grounding is helpful just for everybody in general, right? So you do know what that experience is like, and you have something to come to when you do get the rumination under control, but just don't get stuck in it. So like some basic education, I think, is always helpful, but yeah, just don't get stuck in it. Does that make sense?
Yep.
Lucy, there's a question in the chat. How do you address it when a client is afraid of the existential OCD thoughts and experience coming back? I have a client unsure if they were in a different dimension for many months before it was diagnosed as OCD. This was highly distressing. So she now has, I could imagine that would be very scary to go back.
Sounds terrible. So how do you address, what was that? Them worried about going back into it? Yeah, I mean, so not to oversimplify, but that is an obsessional doubt, just like any other. So you can look at the construction of the story and confirm with them that they have been able to get back to their real self. But it is continuing to kind of train in what the real self feels like, and building that trust, you know, that you can be there. That sounds really scary.
I have a question to piggyback on that about things that might appear as delusions, right? And then we later come to find out it's not delusions. And I'm worried about there being such a lack of OCD knowledge in our field, especially with prescribers and higher level, you know, psychologists and psychiatrists identifying things as schizoaffective, schizophrenia, you know, as delusions, and not knowing how to assess this. I just wonder if anyone has seen that, but I would not be surprised.
I feel like I've heard stories, but that's as much as I know, like just about things, OCD being misdiagnosed. I do remember one case where it was they weren't sure, but they were at least looking at OCD.
But wouldn't in psychotic disorders be more positive symptoms present as well? Like auditory hallucinations or things of that nature? Maybe that could be a distinctive factor. Or a concomitant disorder, actually. That would make it even more complicated for diagnostic purposes.
I would hope so. I just definitely not trying to be negative. I just think that there's a lack of knowledge and overall. And I'm just so glad to hear you talking about this in this setting and getting the word more out.
About great. Good.
Yeah, if a client comes and says that I'm living in an alternative reality, that sounds very psychotic on the surface. You have to, right? So that I think that is the skill of doing true appropriate assessment, to look for other confirmation.
Right. I mean, and that's why people won't say anything for a long time.
And, you know, Fred talks about I-CBT being on a different spectrum from anxiety disorders, more being a thought disorder. So it would make sense that it would get confused if you're not really clear about what OCD is. And looking at it through an I-CBT lens, you can certainly differentiate those out. So it is 2:00. Lucy, you have tons of accolades in the chat. Thank you. Very helpful. Wonderful presentation. This was great. I think everybody was very appreciative of you showing up today and presenting your knowledge and expertise on existential OCD. Thank you.
Thank you.
We will be meeting next week. I'm not sure if we have a presentation or if
it'll just be an open discussion.
So next week will be case consultation. Guys, when we start this was Mary's brain idea, great idea, on the book club that's starting in January. We're going to be asking other people in the group to be facilitators for that. So be thinking about, if you want to volunteer, reach out to one of us. And if you have a particular chapter you'd like to volunteer facilitating. You want to add something, Mary?
I just want to say, for the facilitators, like, no presentations, it's just discussion. You know, it can just be very open and organic, like, what made sense to you? What do you feel confused about? What did you like? What do you know? So I'm even I'll just take the impetus to ban presentations for this. It'll just be discussion.
All right. Thank you, guys. Y'all have a great weekend.
Thanks, everyone.
Thank you.